So thank you very much for inviting me. So my name is Dvir KEREN. I will speak in English, speak French. My disclosure, I'm the founder and the inventor of this technology. Also the CTO of the company. So what is Hairstetics? What is the problem? We see that many females suffer from alopecia, are either reluctant or medically unsuitable to go to hair transplantation. So we developed a technology which is basically suitable for males as well, but we currently mainly focusing on females. So the technology is that I wish I demonstrate it to you. So the technology is basically we have cartridges which are preloaded with hair fibers, and it comes sterile. In each cartridge we have many hairs, either 25 or 12 hairs in each cartridge. So this is the product. You get a tray which is sterile. You simply open it. And have a skin pad somewhere. So this is like a skin pad, okay? And what the physician actually does, he takes the cartridge and it's like an injector. We call it hair injections because it's simply very much likely as doing Botox and fillers. It's like an injector. So we have an injector with many hairs, and the physician just go into the skin, press a button, and withdraw from the skin. And here in this case, we implanted 25 hairs. Okay, so this is basically the technology. And then it takes the next cartridge, so everything is disposable. So it takes the next cartridge and implants the next one. Okay, so what you can see here, basically the implant of Hairstetics. This is what we call below the skin. The size of it is very, very similar to the size of the natural hairs. Okay, so we don't artificial materials more than the natural hair. The shaft itself is made from nylon, which is the same materials that we use for surgical sutures. Okay, so this is a surgical sutures that we design in a variety of colors. And the tip of it, we have a 19-0 alloy. 19-0, I actually have a few startups in the field of cardiology, and this is the alloy which actually made the revolution in the field of interventional cardiology and radiology. The cardiologists use it to put stents, either in the coronaries, or in the radiologists put it in the carotid stents. They also put it, if you know the TAVI procedures. So currently the aortic valves, which are being implanted in the endovascular approach, are made from 19-0. Also the neuroradiologists put it as brain aneurysm coils. So both materials, we have only two materials in the implants, and both of them are highly biocompatible. The patent itself is about the anchor. The anchor, basically when it is inside the needles, in each needle we have one graft, okay? So when it is inside the needle, the leaves are shrink, and we inject it below the skin. This tiny anchor simply deploys laterally, so it deploys two leaves to the sides, and this is how we get the fixation. The fixation itself is immediately 2.5 stronger than the natural hair. So there is no downtime. Simply inject, and the hair is already fixated and in the final length. This is the size of the anchor. You can see it, how tiny it is. Okay, it's about the size of the tip of the nose, of the nose of Lincoln on 5 cents. Okay, so it's very tiny, and as I mentioned, it is highly and commonly used in medicine. So what are the advantages of Hairstetics? First, it's a very quick procedure. Okay, it's very, very nice to see that females coming into the clinic and 20 minutes afterwards going up with hers. Okay, so this is one, I think, major advantages for the doctors and for the patient. They see an immediate outcome. Okay, so don't need to imagine how they will look like. In some cases, we even give them mirrors, and they even point where they want the hairs during the procedure. Okay, and of course, it's a very user-friendly. So for the doctors, I think it's a very nice procedure for the doctors. They work very fast, and they don't need to do harvesting of the skin. What are the medical indications of hairstetics? Okay, so currently we are focusing on females androgenetic alopecia only. Okay, we make sure when we do screening, we make sure that there is no skin disorders, that there is no psoriasis or other skin disorders, and that the patient suffers from androgenetic alopecia. Okay, currently we don't have enough supportive data to other indications such as superficial alopecia, alopecia areata, or frontal fibrosis. So any alopecia which is associated with autoimmune, we currently do not support. And we already started to run a study. We did one case in Israel and also a test also in France for patients that are post-chemotherapy or post-cancer treatment. This is an ongoing study, and hopefully next year we will bring results and see whether we can support these patients as well. Regarding the aesthetic consideration, so we have a variety of colors. Okay, so we can support from blonde to black. Currently, we don't have red colors and white colors. This will be further introduced. But the blondes, browns, ash blonde, and black, we have all this variety of that. All of them are again made from surgical sutures. We also have the physician can choose whether he wants to have straight hairs or curly hairs, so indicate what hairstyle he needs. But we don't have a very, very curly hair. Okay, so if the hair is very, very curly, what we call afro, that we cannot support currently. We also make sure that the patient have enough length. So if you have more than 6-7 centimeters, he is suitable for the procedures. If he has shorter hairs, then it will not look natural. So we want to have at least 6 millimeter length. I can show you a few cases that we did. This was done in Israel, in Tel Aviv, by Dr. Lea. What we see here is the before, this is the after. I want you to look at it because it's a little bit different than how you design a hair transplantation, okay? You know that females have a diffuse pattern, okay? So this female suffers from alopecia all over the scalp, okay? And wherever she will put the midline or put the line in the sides or in the centers, you will see this pattern, okay? But what we do in hairstetics, because we basically control the angulation. I demonstrate you a perpendicular cartilage, but we also have an angular cartilage. So we control the angulation and we have a final length. We basically implant in a final length. It enables us more flexibility in the sense that we worked only in this area. We directed the hairs to the side, okay? So this is what we did. We worked only in this area. We directed the hairs to the sides. So in this case, about, I think it's 600 hairs. If I have 620 hairs, got a very nice outcome. And bear in mind that this is, when she came to the clinic, this is how she looked 25 minutes afterwards. This is another case. Again, we worked only in this area. Here we need less hairs, and you can see the outcome, okay? So I think for females, you see a lot of emotional impact on the patients because it's like a magic. They see immediate results. This is something which become very addictive for the patients. You see that they are coming repeatedly more and more because they feel that it is fast and they see the immediate outcome. They don't need to imagine how they would look like a few months or sometimes even years later. This is one of the first cases that we did. I think it was done 8 years ago by Dr. Smaja in Paris. Okay, the clinical trial that we did. were done in Paris. So we were not courageous to walk on the front line. We don't know if the technology was safe back then. So we started in this line. So you can see that from this line, when we started, there is a very, very nice coverage. Okay? This female is around the age of 30. She had 2 pregnancies. And she had an alopecia which is post-pregnancy. We see lots of females in this category. Most females recovered, but some of them it becomes permanent. And afterwards, I think Dr. Smadja even closed this area. I simply don't have a picture, but we can close this area as well. And you can see the outcome from the sides. And in this case, we did about 400 of those. This is another case that was done during one of the first cases was done in India. Again, we work in this area only, directed the hairs to the sides. This is how she looks immediately after. This is how she looks 6 months afterwards. Of course, if she will comb the hair, by the way, these females have short hairs, so she worked with only one hairstyle. Okay, the shorter the hair is, the less hairstyles that the female goes with. Okay, so she worked with only one hairstyle, and we worked only in this area and directed her to that direction. So if she will comb the hair to the other side, it won't look, we will not see the effect. Okay, so it's also very important to match expectation with the patient and to understand which hairstyle they go, and then you can achieve a very, very nice impact right after the procedure. And regarding the clinical protocol, and again, we put foreign body in the salt. The materials are highly biocompatible, and we cause very much, very, very minimal trauma to the skin. So we see very good dermal integration, but still there are safety measurements to respect. And the most important one is that we do a test. Okay, so for each patient, we first put only about 48 hairs. We follow the patient for at least 6 weeks, and afterwards, we do the full procedure. And we were happy to have a prestige prize by the Incas Academy. We got the first prize of innovation by the Incas Academy for last year. And after that, we started to launch the device. So we launched the device during the COVID. We started to launch the device in Israel because the company is an Israeli company. We are placed in Israel. And it was very nice to see that we have many repeated patients. And we also started to launch the device in France. There are a few doctors here already recognized, and I'm very happy to meet them again. And so the first country out of the US is France. Okay, that got a CE mark, and as we did the clinical trials in Paris, we were very happy to start the penetration in France, and for this reason we are here in this congress. Regarding the capacity, again, we are not ready now to launch the product worldwide, so we are focusing in specific territories, because basically whatever we produce, we sell, but we don't have enough yet. We don't have enough manufacturing force or manufacturing capacity to support all the territories, and we're going to increase it in the upcoming year. That's it.